Hello, this is Dr. Krishan. In our ENT residency MedPG series of the instrument section, we are coming with the second video, which is on the nose. So we'll discuss nose instruments. Nose instruments we'll discuss in two parts: nose instruments part 1, nose instruments part 2. This is the part 1 video in which we will discuss the instruments of functional endoscopic sinus surgery. Basically, this is also useful for undergraduate as well as postgraduate residents, as well as those who are appearing in the MS exam, MS DNB exams or diploma. So here are the instruments of functional endoscopic sinus surgery. We'll start with speculum. This is speculum. So there are many types of speculum, but surgical speculum are slightly different from those speculum which we use in OPD. You must be knowing about the Thudicum's nasal speculum, which is the named after the JLW Thudicum, and that is held in the left hand. Everyone knows this, the technique of holding it. After that, we have a longer version of Thudicum's nasal speculum known as St. Clair Thompson nasal speculum. So other speculum we don't have. So after that we have Killian's. This is Killian's self-retaining nasal speculum. So this is a long bladed. It comes in the different sizes, and this screw in this screw is not functional, but in many new instruments which we have, it is functional, so we can retain it. For example, we want to hold it in this position, then we can take the help of this screw. So after that we have vena speculum. Then we have Richter speculum. That is a similar to vena, but that has a smaller blade. Then we have Cottle speculum. There are many other speculum, but the most commonly used is Killian's nasal speculum in surgical procedure. Many use vena also, but Killian's and vena. After that, this is the blade which we use for. This is BP handle. We use 15 number blade for most of the nasal procedures. After that, we have this. This is a ball probe, which is commonly used in the nasal surgeries. So this is a ball probe which we commonly use in nasal surgeries, and for probing something, for removing any soft tissue, we can use it. This is frontal probe. This has a different angulations. This is for frontal sinus basically. This is Caesar. This is Caesar used in nasal surgery. Its curves is slightly different from conventional Caesar which we use in other microsurgeries. So this is Caesars for cutting flaps or some like that thing we can use. So after that we have curette. Curette, it is used in curating the soft tissue from the sinuses if we have some polyploidal mass or tissue thickenings. After that, this is frontal curette. This is frontal curette. You can have, this is frontal curette. And another type of curette which you use commonly in face is J curette. After that we have sickle. Sickle, it is the sickle that we used in ear surgery. We have discussed in our ear video also. So it also has same functions. This is Cottles. This is Cottles. For raising the flaps and other, we can use it. This is Tilly's packing forceps for packing the nose. So after this, these are very common instruments. These are very common instruments which we use in FES. So I'll keep it at that. So these three. So these are black sleeve for removing something without cutting. We can use it. This is straight back black sleeve. This is upturn black sleeve, adult size. It also comes in pediatric size. And this is through cut for cutting some tissues like that. Then we have Kerrison punch. It is used for removing bone. It is available in different sizes. And this is straight Kerrison, this is upturn Kerrison. Similar to Kerrison, we have Citelis, which is smaller than this, Citelis punch. This is Kerrison punch. This is Kerrison punch. After this, we have turbinectomy seizure. You can see that this is turbinectomy seizure. Suction can be connected to it.